Bismillahirrahmanirrahim. Today we are going to learn about the GIT diseases, diseases of gastrointestinal tract, the anomalies which occurs in the gastrointestinal tract. We are starting from the oral cavity. In the oral cavity, first of all, the stomatitis. Stomatitis is the just inflammation of oral cavity. Stomatitis is the inflammation of oral cavity. The inflammation of oral cavity may be due to virus, that may be due to fungi, that may be due to smoking, or that may be due to various types of chemicals. The chemicals can also be there in the smoking. The chemicals can also be there in the uh, while chewing the tobacco, or while taking any other nutritional components, or other component, or drugs, etc., which contain chemicals, which can cause the irritation in this surface of this oral cavity. So that is what we call stomatitis. Stomatitis is just inflammation of oral cavity. That may be mouth ulcer, that may be ulcer in the buccal area, or that may be just the inflammation. The second one is agwesia. Agwesia is the loss of taste sensation of the uh, tongue. Loss of taste sensation in the tongue, that is agwesia. The taste sensation can be lost due to viral infection, or maybe due to the some anomaly in the taste buds of the tongue. That may be due to various chemicals, or that may be due to irritation of the taste buds of the tongue. Xerostomia. Xerostomia is the dryness of mouth. Dryness of mouth is called xerostomia. The stomia, or storm, denote the oral cavity. So the dryness of the oral cavity, that's called xerostomia. This is due to the decreased cholinergic activity inside the body. When the cholinergic activity inside the body is decreased, that leads to the xerostomia. The xerostomia may also be due to the diabetes mellitus, or due to Alzheimer's disease. In the Alzheimer's disease, the cholinergic activity is suppressed. That's why the xerostomia take place. While in the diabetes mellitus, the mechanism is separate, but in the diabetes mellitus, you can also feel the xerostomia, dryness of mouth, in which the patient time and again wants some water to drink. The fourth one is thylism. Thylism is the excessive secretion of saliva, or hypersalivation, that is called thylism. The P is silent over here. Usually, this is due to consumption of drugs. Due to consumption of some psychotic drugs, or antipsychotic drugs, which alter the brain, which alter the physiology of the brain, that may cause the excessive salivation. That may be due to some consumption of anti-epileptic drug, can also lead to the thyroidism. But some other drug, some food component also can increase the thyroidism. For example, the excessive consumption of tea, excessive consumption of theophylline can also lead to thyroidism. Usually in the children, the hypersalivation takes place in those children who consume large amount of tea, which contain theophylline. The fifth one is periodontitis and gingivitis. Gingivitis is simple inflammation of gums. Inflammation of gums is called gingivitis. Gingivitis. And periodontitis is actually the exacerbation of gingivitis. When the gingivitis exacerbate, when the actually the gingivitis leads to the periodontitis. And the periodontitis, the and destruction of tissue around the teeth, inside the gum, the tissue in around the teeth over here, this portion and this portion, the tissue which surround the teeth got destructed, and the teeth which is in contact with the gum also get destruction. There is some decay in the teeth and destruction of the tissue in the periodontitis, while in the gingivitis only the inflammation of gum take place. These also may be due to some amoeba, due to some fungi, or due to consumption of chemicals, or due to consumption of some other drugs. The next one is pharynx and esophagus. The inflammation of pharynx is called pharyngitis, and the inflammation of esophagus is called esophagitis. These two are simple. The definition of pharyngitis: pharyngitis is the inflammation of pharynx. In the diagram you can see over here, this is uvula, this is oral cavity, and this is uvula. That side from the uvula, the back side from the uvula shows the some veins or arteries, prominent veins or arteries in the pharynx. The oral cavity is also inflamed over here. This also shows the stomatitis, but it also shows the pharyngitis, because the pharynx is inflamed over here. So when the pharynx inflammation takes place, this is called pharyngitis. But if in these area, this area and this area, the tonsils, the tonsil gets swollen, and that is called tonsillitis. The inflammation of tonsils is called tonsillitis. But the inflammation of pharynx, just pharynx, is called pharyngitis. The sore throat is the sore mean aching, sore mean pain, sore represent the painful. Sore throat mean the painful throat. This is due to the irritation in the throat area, due to irritation process in the throat. That may be due to the pharyngitis. The sore throat may be caused due to pharyngitis. By the inflammation of pharynx, the sore throat can take place. The sore throat can happen, but the sore throat is something different from the pharyngitis. There may not be inflammation of the throat, while there will be aching, there will be pain in the throat, there will be some painful sensation in the throat. The painful sensation inside the throat is called sore throat, and that is that is one of the cause of the one of the symptom of the flu, that is the sore throat. Esophagitis is the inflammation of esophagus. The sore throat may be caused by Staph aureus, Streptococcus aureus, which I have explained to you already. And the Staph aureus or the Streptococcus aureus is the main cause of the sore throat, while the tonsillitis is actually the inflammation of the lymph node of the throat. The lymph node which are present inside the throat, which are called tonsils, these get inflamed due to bacterial infection or due to viral infection. These tonsils get swollen, that's called tonsillitis. And the pharyngitis may not be due to the bacterial or fungal infection. That may be due to trauma. That may be due to excessive pressure in the pharynx. That may be due to hyperacidity in the pharynx, due to reflux of the acids from the stomach. That may be due to that condition, or sometime due to excessive talking, and also the pharynx gets swollen, that is called pharyngitis. Okay, the next one is esophagitis. Esophagitis is the inflammation of esophagus, and that may be due to the reflux of acid. That may be due to reflux of acid, or that may be due to excessive great volume of the of the bolus, which is swallowed into the esophagus. When the bolus is of large volume, that this may lead to the irritation of the mucous wall of the irritation of the wall of the esophagus, of the lumen of the esophagus, which lead to the esophagitis. Echalacia. Echalacia is the condition in which the cardiac sphincter is unable to get opened by the uh, by coming in contact with the bolus. When this is the normal procedure. When the bolus come in contact with the cardiac sphincter, the sphincter which leads to the stomach, the sphincter which leads to the stomach, that is called cardiac sphincter. When the food come in contact with the cardiac sphincter from the esophageal side, this this muscular mass, or this cardiac sphincter get opened automatically due to contact with the bolus. But when this cardiac sphincter do not get opened due to contact with the bolus, this condition is called echalacia. Echalacia is when the cardiac sphincter is unable to get opened by the contact with the bolus. That is called echalacia. So this is also not a good condition. This is one of the disorder of the cardiac sphincter. Um, uh, there are multiple causes of this echalacia. I will discuss the causes of echalacia in the Google Meet session. The third one is stomach. The various various disorders in the stomach, various disease condition of the stomach. One of the first one is nausea. Nausea over here. Nausea means to feel when an individual feel vomiting. When the individual feel like vomiting, he do not vomit, he do not retch, he just feel vomiting, he just feel a condition like vomiting. That this feeling is called nausea. This feeling is called nausea. The feeling which generally take place before vomiting, that is called nausea. And vomiting is actually the antiperistaltic movement from the stomach to the oral cavity. The antiperistaltic movement from the stomach to the oral cavity, which leads to the evacuation of various stuff from the stomach outside the body. That is called vomiting. While the retching is called dry vomiting. Dry vomiting is a phenomena which is used for the retching is a phenomena which is used, the word which is used for dry vomiting or dry weaving. You can also call it dry weaving. And the dry weaving or dry vomiting or retching, this usually take place when the cardiac sphincter do not open, and you want to vomit, but the cardiac sphincter do not open, or when the stomach is empty. The stomach is completely empty, there is nothing there in the stomach, and you want to vomit. In that condition, you uh, you do an action like vomiting, but there is no vomiting in the real. That is called vomiting, or that is called dry vomiting or retching. The In the stomach, peptic ulcer is also one of the leading diseases. In the peptic ulcer, I have already explained the peptic ulcer to you, in which the mucus layer, disruption of the mucus layer, which is present above the epithelial layer of the stomach. The epithelial layer of the stomach, the mucus layer which is present above the epithelial layer of the stomach, that is when that is disrupted, the disruption of the mucus layer from the epithelial layer of the stomach, that is called peptic ulcer. that is not called ulcer, that is called peptic ulcer. Peptic ulcer, because the peptic ulcer represent the ulcer inside the stomach or the duodenum or the intestine, while simple ulcer do not represent the ulcer inside the GIT. So in the peptic ulcer, the disruption of the mucus layer above the epithelial layer of the stomach or intestine take place. This may be due to the hyperacidity. This may be due to hyperacidity of the stomach. This may also be due to the Helicobacter pylori, the H. pylori. This pylori, that is a type of bacteria which is present inside the antrum part of the then inside the pyloric antrum of the stomach. So the peptic ulcer may be due to the hyperacidity or the due to the H. pylori, or due to consumption of spicy food. That may be due to the consumption of spicy food and proteinaceous diets. That is also due to the proteinaceous diet. Consumption of large amount of proteinaceous diet can also lead to the peptic ulcer. Okay, and the next one is flatulence. We will also discuss all these diseases in the Google Meet session, so you people should not worry if some of the diseases you do not understand properly. The next one is flatulence. Flatulence is actually the which generally we call gas. Generally we call gas it in Pakistan, but flatulence is the accumulation of gases inside the gastrointestinal tract, especially in the stomach. The accumulation of gases inside the gastrointestinal tract, especially in the stomach, that is called flatulence. The flatulence may be due to the presence of various types of bacteria inside the gastrointestinal tract, or due to consumption of various liquids containing gases, for example, soda, water, etc. Or flatulence may also be due to the uh, chewing of the chewing gum. During the chewing of the chewing gum, some of the gases also goes into the stomach. The gases enter into the stomach. That leads to the flatulence-like condition. Or saliva continue due to continuous entrance of saliva from the oral cavity into the stomach can also lead to the flatulence, because saliva, each drop of saliva entraps some air with it, which goes into the stomach. That may also lead to the flatulence, for which you need to burp or belch to get rid of those gases. And the next one is gastritis. Gastritis is simply the inflammation of the gastric layer. The inflammation of the stomach is called gastritis. Gastritis can also happen in the peptic ulcer. Gastritis is the inflammation of the gastric layer of the stomach or the stomach. The next one is gastrointestinal reflux disease, GERD. GERD or gastrointestinal reflux disease. The gastrointestinal reflux disease is a type of disease in which the gastric matter, or in which the food stuff, the semi-solid or the semi-liquid food stuff which is present inside the stomach, um, get back to the esophagus or to the oral cavity. Time and again this happen. This is called GERD, gastroesophageal reflux disease, in which the reflux of the gastric matter happens time and again. This is called gastrointestinal reflux disease. This also leads to the irritation of the wall of the esophagus or the pharynx. The GERD lead to the irritation of the wall of the lumen of the esophagus and the pharynx also. That is called GERD, gastrointestinal reflux disease. And GERD can also happen due to when the peptic ulcer get exacerbated, when the peptic ulcer when the condition of peptic ulcer get worsened, this may lead to the GERD. The next one is Rapunzel syndrome. Rapunzel syndrome is a rare disease. This is not very common. And this disease usually happen due to trichopedia. Tricho mean hair and pedia mean eat. Some people have the habit to eat their hair. Some people used to eat their hair in the layer. So this eating of the hair leads to the Rapunzel syndrome. This eating of the hair, when you eat the hair, when you consume the hair, when the hair goes into the stomach, it is entrapped inside the antrum. This is entrapped inside the near the pyloric sphincter. Near the pyloric sphincter, this hair is entrapped, and this lead to the accumulation. This lead to a ball-like structure inside the near the pyloric sphincter. When the ball-like structure appearance of bile-like structure near the pyloric sphincter is called Rapunzel syndrome. This leads to the vomiting. This leads to the malnutrition. This leads to the various type of ulcer that lead to the various types of gastritis. This have multiple symptoms. So this is called syndrome. This is called Rapunzel syndrome. This is a rare disease, but you should keep in mind that eating your hair is not a good habit, because this can lead to Rapunzel syndrome, and there is only one treatment of this Rapunzel syndrome um, is to cut open your stomach and get rid of this ball of hair. So Rapunzel syndrome is a rare disease. The next one is hiatus hernia or hiatal hernia, or simple you can call it hiatus. You can call it hiatus. In the diagram you can see this is the hiatus hernia or hiatal hernia. Hiatal hernia is not uh, this is not actually the disease of the stomach, but uh, enumerate this disease under the disease of stomach. In this condition, all of you know that the stomach is below the diaphragm and the esophagus is above the diaphragm. The uh, the that area, that point uh, which is in conjunction or in junction with the diaphragm is called cardiac sphincter. So when some part of the stomach get back into the get above the diaphragm, this condition is called hiatal hernia. When some part of the stomach uh, get above the diaphragm, uh, goes above the diaphragm, that is called, this condition is called hiatal hernia. Usually all part of the stomach is below the diaphragm, but when some part of the stomach get into the get above the diaphragm, get herniated into the diaphragm, this is called hiatal hernia. This condition is called hiatal hernia. This is not due to a anomaly in the stomach, but this usually happen in all ages. This usually happen due to some anomaly in the diaphragm. This usually happen due to some abnormality in the diaphragm, or some sort of weakness in the diaphragm, some sort of weakness in the muscles of the diaphragm. This usually happen. Now the next one is Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is, you can call it a type of cancer also, because this is actually this is the condition in which the G cell are the gastrin producing cell. Gastrin producing cells are actually present inside the stomach, inside the pancreas, and inside the duodenum also. The G cell are gastrin producing cells. Gastrin is a type of hormone, and which is produced by the G cell, and these G cells are present inside the stomach, inside the duodenum, and inside the pancreas. when um, when the the G cell or the gastrin producing cell get tumor. This condition is called Zollinger-Ellison syndrome, in which the G cell get tumor, get excessive proliferation. When the excessive proliferation of the G cell happens or occurs, this lead to the high number of the G cell in the stomach or in the pancreas or in the duodenum, but especially in the stomach. Um, when the number of the G cell increase inside the stomach due to tumor, this lead to the production of high amount of gastrin, and when high amount of gastrin take place, a high amount of gastrin secretion take place inside the stomach, what will happen? The high amount of gastrin will go into the systemic circulation, and high amount of what will happen? High amount of HCl will be secreted, because this gastrin stimulate the secretion of proton from the parietal cells. So the excessive secretion of the acid inside the stomach or duodenum due to the tumor of the G cell, that is what we call Zollinger-Ellison syndrome. So this